my name is Andrew Kelka, and this is Obstructive Sleep Apnea. Imagine you wake up in the middle of the night, coughing and wheezing. You're not aware of what's going on, and you feel a choking sensation as you wake up panicked. You sit up quickly, and a loud gas finally gets that air into your lungs, and you feel confused, and you ask yourself, what are these symptoms, and why is this happening? One answer to that question can be obstructive sleep apnea. Obstructive sleep apnea is when something is blocking your airway, and you're not able to breathe in the middle of the night, and you wake up. It's happened dozens of times. Main points that I want to cover is what obstructive sleep apnea is, what are the risks, and what are the clinical treatments, and what are experimental treatments they're trying, and also what happens when obstructive sleep apnea goes untreated. There are lots of characteristics that make up obstructive sleep apnea. Dr. Kingsman Klein from Case Western Reserve University describes obstructive sleep apnea as when your airway is blocked in the middle of the night and you wake up suddenly. There are a couple characteristics that make up obstructive sleep apnea, like restless sleeping, snoring, irritability, excessive daytime sleepiness, and headaches. Kingsman also did a study on the prevalence of obstructive sleep apnea in adults, and it shows how 2 to 9% of adults have obstructive sleep apnea in the middle of the night. Now, you're probably wondering, what are the risks? And Dr. Klein from Temple University of Medicine talks about how it's primarily in Hispanic and African American men who are aged 50 to 60 years old, but it can happen at any age, really. And he talks about how there are big risks to cardiovascular diseases like strokes, heart attacks, coronary artery disease, as well as risks to obesity that come with this disease. And on top of that, there's also mental health disorders that can come with obstructive sleep apnea, like depression and generalized anxiety disorder. And so, now that we know the risks, here are some of the treatments that come with it. And Dr. Kingsman Klein, again, goes about what treatments are available for you to do, like exercising, weight loss programs, not smoking or drinking, laying on your side even can be effective as you open your airway from being blocked in the middle of the night. And he says this golden standard of this CPAP machine stands for continuous positive airway pressure machine, that basically is a mask you wear in the middle of the night, like the one shown here, that opens your airway so you don't wake up as frequently during the night. And this improves sleep and reduces times waking up in the middle of the night. And there's also surgery, which is another option to remove the muscles in your tongue and throat so that it doesn't block your airway during the night. Now, Dr. Heiser also gave a study of 508 participants who failed CPAP treatment to do this alternative treatment of having this upper airway stimulation system, which is basically a little device implanted on your chest that essentially gives a little impulse to the muscles in your throat and tongue to open the airway so that you can, in the middle of the night, not have to stop breathing and wake up and go back to sleep again. And 83% of the people who in this study found improvement in this device. And you're probably asking to yourself, why would you want to do this, Andrew? And an answer is, it's a good replacement if the CPAP machine didn't adjust well to your treatment. And it's a good alternative. Now, what happens when it goes untreated, Andrew? What then? Well, 80%, Dr. Lee from Northwestern University states how 83% of people with obstructive sleep apnea go untreated. Now, this is because people just don't notice it as much, and this can lead to more fragmented sleep, which leads to more stress, which leads to faster aging in your cells, which leads to more risk to cancers, dementia, Alzheimer's, strokes, all these diseases that come at risk when it goes untreated. Now, that is why you need to be treated. And to review, obstructive sleep apnea with treatments to yourself and the CPAP, and also alternative treatments, can all improve. We now understand that they can improve your symptoms of obstructive sleep apnea. And we also saw what happens when it goes untreated and the risks that come with that. And so obstructive sleep apnea is when the muscles in your throat block your airway so you can't breathe in the middle of the night and you wake up. And so if you happen to wake up in the middle of the night coughing and wheezing, I would recommend talking to your healthcare provider to see if it might be obstructive sleep apnea. Here are my sources. Thank you very much.